have you ever been to the dentist and they've told you you should floss or brush better? I know I have. I used to have braces and I didn't like flossing my teeth. It was too time consuming and too much trouble. I've been a dental assistant for 2 years now, and I'm going to be majoring in dental hygiene. And I have had a lot of patients where we have told them you should floss, you should brush, and they have said right back, I wish I had done that when I was younger. And as many people have learned nowadays, it is great to floss and brush. So I'm going to tell you about what periodontal disease is, the effects of it, and how regular cleaning appointments and oral hygiene is better for you. So according to the National Institute of Dental and Craniofacial Research, during periodontal disease, that is where bacteria gets stuck in between the tooth and the gum, and it creates kind of like a pocket. So it's a pocket filled of bacteria, and it eventually destroys bone. So it's sitting in there and it's creating decay and creating the bone to deteriorate. There's 2 ways to diagnose periodontal disease. The first way is they take a little ruler, and it's in millimeters, and what they'll do is they'll put it right in between the gum and the tooth. If it sinks and goes down, that means you have periodontal disease. So anything from 4 millimeters and above, that means you have a lot of inflammation and a bigger pocket right there. If it's tight and pink and not bleeding, that means you have healthy gums, and that's usually 1 to 3 millimeters. Now, usually a lot of people have 4, and what that is gingivitis, and that's the first part of periodontal disease. So if you have 4 millimeters and you don't floss or brush, it'll continually get worse. Now, the second way to determine if you have periodontal disease is by x-rays. Now, I don't know about you, but they look a lot different to me. So the first one, all of this area right here is bone. Now, your bone level should be about even for every tooth. That's what holds your tooth in place. Now for this one, as you can see, it is significantly lower the bone level is. So there's less holding on to that tooth, which means eventually you may lose your teeth, which is very unfortunate. You can also see on some x-rays, you can't see it on this one, on the sides of the tooth you can see a little like pokey thing sticking out, and that's usually tartar. And if you got tartar under your gum line, that means you need to have deep cleaning, get that out of there. It's not good for you. The causes of periodontal disease is not brushing, of course, having that plaque sit on there and fill in that pocket, tartar, and then not brushing or flossing, obviously. And then next I'll talk about the effects. So according to Mayo Clinic, periodontal disease can cause tooth loss. Like I showed you in the x-ray, nothing is holding on to that tooth. It starts getting loose and eventually it's got to go, which is unfortunate. I've seen a lot of people that's happened to them a lot, and it's very sad to see that. It can also cause other oral problems like decay, since that bacteria is sitting in there. Bad breath, receding gums, if you've ever seen that, the gums get really low and you can see a large amount of your tooth. Painful chewing, and of course tooth decay. Now, according to Mayo Clinic again, they suggest that bacteria is associated with periodontal disease in your regular health. And what that means is the bacteria can travel in your bloodstream and can cause things like stroke, respiratory problems, arthritis, and it can actually cause you to have premature babies, which is crazy. Yeah, it's just something in it that just triggers the hormone to have your baby. Now lastly, I'll talk about how to prevent and treat periodontal disease. According to perio.org, gum disease can be preventable. If you brush and floss at least twice a day, you should be fine. And of course, have regular cleanings. Now, if you have periodontal disease, you will probably have to have a deeper cleaning, which is called scaling and root planing. And Usually they numb you up for it. It costs hundreds of dollars, and that's not fun. You can save a lot of money in the long run with that. You can also see a periodontist for a bone graft, which they just make more bone to help the teeth hold on. And they can also do a gum graft, which they just add more gum to hold the teeth in. In conclusion, periodontal disease can be really serious, and it's easy to prevent. And if you can prevent it, why not? It'll save you a lot of money and time. Okay.